It was one of the hardest decisions that I've had to make.
And it is something we have heard from many of our frontline hospital workers through the pandemic. Tonight we meet a Phoenix ICU nurse who's joining many others in her profession, stressed, saddened, and exhausted, calling it quits after years on the job. She says the pandemic has left her with depression and PTSD. Many thought the vaccines would stop this cycle of surges of new cases. Well, now, as we see yet another uptick from this highly contagious Delta variant, many of our nurses are close to their breaking points. Emma Lockhart's joining us live from Phoenix with more. Emma?
Paulette Rangel walked away from a job she once loved. She says the stress she experienced during the pandemic was just too much. Even when COVID cases went down, the trauma stayed with her.
This was Paulette Rangel at the start of the pandemic, kissing her 2-year-old son through a window as she self-isolated in her room. The ICU nurse feared she would bring the virus home to her family.
I was starting to get feelings of not wanting to go to work and just, driving into work and just dreading being there.
That kick-started a mental health battle while fighting COVID on the front lines. Watching helpless COVID patients die alone in the ICU left her with depression.
Having to see that every day was difficult.
Even as vaccines rolled out and COVID cases went down, Rangel says her job never got easier.
We were still getting all of these patients that were sick, that were waiting, all this time for surgeries, and so they were getting worse.
Rangel says she tried going part-time, but the hospital was too short-staffed. In June, she walked away for good.
I feel guilty for, quitting. I feel like I quit on my friends. I feel like I quit on my family and my patients.
Rangel isn't alone. A nationwide study in April found 48% of ICU nurses are considering leaving their jobs.
Ultimately, I have to decide what's best for me and what's best for my family, and that's what I did.
Now you'll find Rangel in a different role and much happier. She's working as a nurse supervisor for the healthcare center Valle del Sol, a job she says still feeds her passion for helping others.
I'm still contributing to preventing COVID-19, vaccinating people and being able to prevent them from having to go into the hospital.
Now, Rangel did not want to name the hospital where she worked, but she says a lot of her other colleagues left too. She says her heart goes out to the other healthcare workers still on the front lines, bracing for another COVID wave. Jared.
Emma, you mentioned staffing in your story. Do our hospitals have enough nurses on staff right now?
Well, Banner Health, the state's largest hospital system, has hundreds of openings right now. A spokesperson says nurse shortages are at an all-time high.
Could certainly understand how this has just been exhausting for them over the last year and a half. Emma Lockhart live in Phoenix. Thanks, Emma.